Good morning, everyone. I am Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Substance Use Disorder Providers National Accreditation Process Overview with Danielle Smith-Joseph. This webinar is being made available through a collaboration of the Florida Department of Children and Families Office of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the chat panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website within 30 business days. To access the recording and PowerPoint, go to www.fada.org/resource center/training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as a part of registration remains confidential. Statements of credit will be posted within 5 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note the evaluation will close at midnight on Monday, May 3rd. 1 to 2 continuing education credits are available for participating in today's webinar. For persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors your arrival and departure of attendees and provides a report upon completion of the event. We are not permitted to provide or certificates of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit. Danielle Smith-Joseph is the Director of Quality and Performance Improvement at River Oaks Treatment Center in Riverview, Florida. She oversees licensing and accreditation, risk management, performance improvement, and clinical outcome measurements. Prior to joining River Oaks, Danielle was a quality improvement specialist with Central Florida Behavioral Health Network, where she monitored and provided quality improvement consultation for several behavioral health programs across the Suncoast region. She has served in several clinical and administrative roles throughout her years in behavioral health, with extensive experience in coordinating and leading regulatory surveys, including the Joint Commission and CARF surveys. Danielle holds a Master's of Public Health degree as a proud graduate of the University of South Florida College of Public Health. She also holds degrees in biochemistry and nursing. Danielle is a registered nurse and a certified professional in healthcare quality and healthcare risk management. And now I'd like to welcome our presenter. I will turn the presentation over to you now.
Good morning, everyone. Thank you for participating in today's webinar, where we'll discuss the accreditation process for substance use disorder providers.
Rebecca, can you change the slide deck? There we go.
So Rebecca's already provided my bio, but I've included my contact information if you have additional questions after the presentation. But before we begin, I'd like to give a few disclaimers. So I am not employed by or personally affiliated with any of the accrediting organizations that we'll discuss today, nor do I endorse any accrediting organization. The purpose of today's presentation is strictly informational. So our learning objectives, by the end of today's presentation, I hope that you will be able to recognize the value of accreditation in substance use disorder providers here in Florida, learn a little bit more about CARF, the Joint Commission, COA, which are the three accrediting agencies we're going to be discussing today, and the process for gaining accreditation through these three agencies. And then finally, identifying some of the best practices to help your organization not only gain accreditation, but maintain that accreditation through continuous quality improvement. So let's jump right in. What is accreditation and why is it important? Accreditation is a process of review that allows healthcare organizations to demonstrate their ability to meet regulatory requirements and standards established by a recognized accreditation organization. It reflects your organization's commitment to a standard of quality in its operations and in the patient or client care provided. Your organization demonstrates that by adhering to the standards set by the accrediting agency. Now, accreditation is different from licensing. In order to operate a substance use disorder treatment program here in Florida, your organization must be licensed by the Department of Children and Families and meet the standards for that license or those licenses for which you're applying. That is the requirement. However, accreditation, on the other hand, is usually a voluntary process, and I say usually. Your organization is able to choose the body that you wish to seek accreditation from based on the structure of your organization and the needs of the organization. And your organization makes a commitment to adhere to those standards set by that body in order to maintain that accreditation. Now, I said usually voluntary, and then I'll explain why in a few minutes. So what are some of the reasons that organizations seek accreditation? For one, it improves the process of care provided. It was found that accreditation drives better outcomes, and organizations with better compliance with accreditation standards had better outcomes for their patients. It also demonstrates a commitment to quality, and it drives continuous quality improvement. An important part of every accrediting process is the tracking of data and the trending of data and making those changes in your organization based on data. That's what continuous quality improvement is. Also, because the accreditation standards are always being reviewed and updated to reflect the changes in the industry and best practices, it more or less forces organizations to continuously update their processes and their procedures to maintain that compliance and stay on the cutting edge of best practices and industry standards. It also creates distinction among competition. So being a nationally accredited program can set you apart from other programs in your vicinity, in your state, or in your area. And the type of accreditation you maintain can also create distinctions and set your organization apart as well. In addition, it can help drive revenue for the organization. Some payers require that your organization be accredited. In 2000, it was found that 95% of contracts made by managed care companies were to accredited providers. And that was in 2000, so I'm sure that number has only increased since then. And then accreditation has been found to positively impact the organization's internal processes, their culture, their training, and their institutional image. It creates a standard and a level of performance that everyone in the organization is expected to meet and aspire to. Now, there may be some drawbacks for organizations to consider when seeking accreditation or when looking into the process. So sometimes it can often require large-scale changes to the organization's processes. It could result in major changes in the way that your organization operates in order to become compliant with those accreditation standards. So it could be anything from the way that you do treatment plans, to your hiring practices, to even your physical plans and the setup of your facilities. It could involve changes across every aspect of your facility, and those might be major changes for your staff and for your leadership team to undertake. It can also be a lengthy process. It can take anywhere from 6 to 24 months for an organization to become accredited. So it definitely isn't a quick, short-term project for most organizations. It also requires a significant investment of human resources dedicated to that preparation and compliance. As we'll discuss, accreditation touches every aspect of your organization, and it requires quite a bit of planning and coordinating, not just to become compliant with the standards, but to maintain that compliance ongoing. Depending on the size of the organization, this might require designated staff. So whether it be a compliance manager or a director of quality or even a quality team who's working on maintaining these standards and establishing this accreditation, it could vary for the organization depending on the size and the services that you provide. And lastly, it's not cheap. Accreditation is a pretty significant financial investment, regardless of which accrediting agency you decide to choose or which one you're affiliated with. So there are several things to consider when making a decision on becoming an accredited organization. And while there are some drawbacks to consider, there's one more reason why you should be an accredited organization. In Florida, it's the law. Legislation passed in 2017 requires accreditation for each licensed component providing clinical treatment. So while your choice of accreditation organization is voluntary, you can choose whichever one you'd like, the choice to become accredited as a substance use disorder provider in Florida is not. So there are several accrediting bodies across every sector of healthcare. But for behavioral health and for substance use disorder treatment providers, there's what I call the big three. There's the Commission on Accreditation of Rehabilitation Facilities, or CARF. There's the Joint Commission, formerly called JACO, now called the Joint Commission. and there's the Council on Accreditation, or COA. Now, before we get into the details of each of these three accrediting bodies, there's some things you'll need to keep in mind if you're considering accreditation or trying to decide which option is the best fit for your organization. So first off, you need to consider your payers. Some payers have a preference of which accreditation they accept for their contracted organizations. So that's an important factor. For example, some organizations that participate with Medicare and Medicaid programs may seek accreditors who have deemed status, meaning that through their accreditation with that body, they meet or exceed CMS standards, or in the case of opioid treatment programs, SAMHSA standards. So that's a consideration. Another consideration is the population that you serve and the acuity of the population that you serve. For example, if you serve a higher acuity clients, such as detox clients, then perhaps Joint Commission standards might more closely align with the services that you want to provide and the level of safety that you want to provide. So some of the things you need to keep in mind as we explore these three accrediting organizations. So we'll start with the Commission on Accreditation of Rehabilitation Facilities, or also known as CARF. CARF is a nonprofit accreditor of health and human services in several areas, including aging services, behavioral health, child and youth services, employment and community services, vision rehabilitation services, medical rehabilitation, and opioid treatment programs. The CARF International Group of Companies currently accredits more than 60,000 programs and services at over 28,000 locations. More than 15.3 million persons of all ages are served annually by 8,000 plus CARF accredited service providers, with 227 of those providers right here in Florida. CARF accreditation also extends to countries in North America, South America, Europe, Asia, and Oceania. So a brief history on CARF as an organization. They were formed in 1966 by two organizations coming together. The Association of Rehabilitation Centers, which included rehabilitation centers such as the Salvation Army and Goodwill Industries, and also the National Association of Sheltered Workshops and Homebound Programs, which were programs that served individuals with physical and developmental disabilities. By 1986, they had expanded into alcohol and drug treatment programs. And then in 1995, they restructured their entire organization into three main fields: vocational and employment or developmental disabilities, medical rehabilitation, and alcohol and other drugs/mental health. That year, they also published their first standalone behavioral health standards manual. Then in 1997, they got a SAMHSA grant to develop an accreditation program for opioid treatment programs. So it's not, CARF hasn't been around as long as some others, and it's fairly new, and so you'll notice that in the way that it changes and evolves, and the way that the standards change and evolve over time. So is CARF the right accreditation for your organization? There are some distinctions that set it apart from other accreditors. So CARF is specific for health and human services organizations. That means that the language that they use in their standards and the focus of their standards are specific to health and human services organizations, as opposed to being adapted from hospital standards or standards from other industries. also utilizes a peer-to-peer consultative approach. To become a CARF certifier, you must be employed in a CARF accredited organization or employed by a government entity that works to improve the quality of human services. And you need to have at least 5 years of experience in the field. So your surveyors during your CARF survey are your peers. They're working in the same field, they're having the same experiences, and even some of the same challenges that you are. So that makes for a really consultative, collaborative approach and process during the survey experience. And then CARF program standards emphasize person-centered care. They're very much focused around the individual served, and that individual is expected to be an active participant in all aspects of the services that they're offered. Now, CARF standards are divided into 3 sections. Section 1 focuses on the operations and the administrative functions of the program, and it's branded as their Aspire to Excellence framework. Now, this breaks down into the following. So, assessing the environment, setting the organization's strategy, obtaining input from stakeholders, including the individuals served, implementing their plan, then reviewing their results, and then affecting change. Now, those of us familiar with process improvement strategies, this will sound incredibly familiar. But CARF has taken this approach and applied it to running a program in a more macro sense on a larger scale. So some of these subsections within Section 1 of the CARF standards. A is leadership, which focuses on the organization's leadership structure under leadership guidance, their commitment to diversity, their corporate responsibility, and their corporate compliance. Section B is governance, which covers the organization's governance policies, the selection and the performance of their board of directors, as well as delegation of authority within the organization. Section C focuses on strategic planning, which considers not only stakeholders' expectations for the running and the functioning of the program, but also environmental impacts as well. The organization is expected to have a written strategic plan that sets goals. And that plan should be not only implemented, but shared with the stakeholders and kept relevant. Section D covers the input of persons served and other stakeholders. So an ongoing collection of information from a variety of sources is expected of the organization. And that information should be analyzed and it should be incorporated into the business practices. And this data can include your clinical outcomes, client satisfaction, staff satisfaction, feedback from the community, recommendations from the board, and so on. Section E covers legal requirements, which include compliance with all of the legal and regulatory requirements for the agency. Section F covers financial planning, which talks about preparing and sharing your budget as it relates to the strategic plan, the financial results compared to your budget performance, fiscal policies and procedures, a review of your billing services and your fee structure, financial reviews and audits, and also, very important, safeguarding the funds of the client served. The risk management section covers the identification of loss exposures, the development of your risk management plan, and then having things in place such as adequate insurance coverage and things like that. Section H covers health and safety. So that focuses on your health and safety inspections, the emergency procedures that your organization has in place, access to emergency first aid, competency of personnel and safety procedures, reporting and reviewing your critical incidents, and also infection control. Human resources covers adequate staffing within your organization, verification of backgrounds and credentials for your staff, recruitment and retention efforts, personnel skills and characteristics, the annual review of job descriptions and performance evaluations, as well as staff development. Technology, the organization is expected to have a written technology and systems plan, and also written procedures for how to use those systems in service delivery. Like, for example, now having telehealth. Some organizations didn't have that before. Now they need to develop plans and processes around what systems they're going to use and how they're going to implement that, and how their individuals that they're serving are going to be able to access that. Also training for their staff around that equipment and maintenance of that equipment as well. Under rights of person served, that addresses the communication of the rights to the individual served, policies that promotes the rights of individuals served, as well as the organization's complaints, grievance, and appeals policies. Accessibility covers the process for the person served to request reasonable accommodations as required by law, and each organization is required to have a written accessibility plan that addresses that. Under performance management and measurement, that includes the information collection, the use, and the management of information within that organization, and also setting and measuring performance indicators, which should align with the strategic goals of the organization. And finally, performance improvement, which includes proactive performance improvement within the organization, and then sharing that information with the stakeholders. The second section of the CARF manual covers the general program standards, and this section gets into the details of service delivery. It provides the standards for how care needs to be provided within your organization. So the first section covers the structure of your program. So things like your program plans and the types of crisis intervention that's provided, your policies and your procedures around medical consultation or clinical supervision. The Section B covers screening and access to services, which includes identifying your admissions criteria, which clients you'll accept and which clients that you don't, providing orientation information to those clients, your primary and ongoing assessment process, and how those are conducted to determine appropriate placement into your services. Section C is all about treatment planning. There's a whole section dedicated just to treatment planning. Section D covers the transition and the discharge process. So that covers referral or transition to other services or other programs, planned and unplanned discharge referrals, and how those processes look. The plans to address the client's needs, strengths, abilities, and preferences, and then follow up for individuals that you've discharged from your program. Section E focuses on policies and procedures for prescribing medications, dispensing medications, administering medications, and the training regarding those processes. And it also covers policies and procedures for safe handling of medications, not just for nursing staff or staff at the organization, but also for the education for the client as well. Section F covers nonviolent practices. And organizations are expected to employ the principles of engagement and partnership, power with and not power over the person served. Principles of respect, hope, self-direction to garner that engagement from the client, as opposed to using things like seclusion and restraints and more invasive practices for managing the milieu. Section G covers the record of the person served, and that includes items of confidentiality, the time frames for entering records, and the individual record requirements. And then Section H covers quality records management, which covers the organization's procedures for reviewing their records, both open and closed records, and then using that information to improve the quality of their services. The third section provides the expectations that are specific to each of these core behavioral health programs. And to name a couple of the ACT teams or the FACT teams here in Florida, drug court programs, office-based opioid treatment programs, therapeutic communities, they each have core standards outlined by the Joint Commission that each program type needs to meet. And that also extends to support services, such as call centers or assessment or referral programs, community housing, prevention programs, diversion programs, and so on. And then that even extends to special population designations, such as children and adults with autism spectrum disorder, or eating disorder programs, or programs that serve older adults. So what are the steps to a CARF accreditation? So first, you want to consult with a designated CARF resource specialist to receive guidance and technical assistance regarding the accreditation process. So once you connect with a resource specialist, they'll be able to walk you through getting the accreditation process started, which includes setting up your organization's profile on CARF's Customer Connect portal. And that portal is where you'll typically find your resources, and that is where you're going to communicate and share your information with CARF. That's where you'll submit your applications, that's where you'll get your annual conformance report and things like that through that portal. And then they'll also help you with obtaining the most recent edition of the Behavioral Health Standards Manual. Now, once you get your manual, you need to conduct a self-evaluation for your organization. This will determine the starting point of your preparation. So your organization will complete that self-study and that evaluation of its conformance to the standards, and then develop a plan to address any areas where there are any deficiencies or where your policies or the procedures of your organization deviate from CARF standards. Once you've done that self-study, you've identified those areas, you've worked to get into compliance in those areas, then you can submit your application. And your application includes detailed information about the leadership of your organization, the programs and the services that you provide or that you're seeking accreditation for, as well as the service delivery locations, if you have more than one. And then comes the money. Then you pay your survey fee. The survey fee is based on the number of surveyors that will have to come out or participate and the days that are required for the survey. And then this may also be tied into the size of your organization, the number of programs that you plan to have accredited, as well as your census around the time of your survey. Then once you've submitted your application and your fee, CARF selects the survey team that will come out and participate in that review of your organization. Surveyors are selected by matching their program or administrative expertise and the relevant field experience that they may have with your organization's unique requirements. So they'll try to match you up with somebody who has similar experience, similar background to the services and the personnel of your organization. Within about 30 days or so of the anticipated survey date that you provided to them, CARF will set the organization's specific survey date, and then the organization will then post those dates at least 30 days prior to the survey. All this while, you're still preparing, you're still gathering your documentation, you're still monitoring your compliance in advance of the big day, or the big days, depending on the length of your survey. That's when your survey team comes on site, or they may do it virtually now that we're in the days of COVID, to determine if your program or your programs are in conformance with the applicable standards set forth by CARF. This might be done, like I said, on site, or it might be done virtually by observing your programs, by interviewing clients, interviewing staff, reviewing documentation, reviewing policies and procedures, or records. And then in this process, this is where the surveyors provide that consultation. So, like I said, they're your peers. They're people who have been working in the industry, who currently work in the industry. So that is where you'll get feedback and recommendations, best practices, and how your organization can improve. Following the survey, CARF renders their accreditation decision. So based on the findings of the survey and the recommendations put forth, CARF will render an accreditation decision. Now, what happens next? So about 6 to 8 weeks after the survey, CARF notifies the service provider or the organization of the accreditation decision. A 3-year survey, a 3-year accreditation is a full accreditation. That's the max that an organization can get. A 1-year survey means that there are some items that you need to work on. They're not quite sure of your compliance with the standards, your conformance with the standards yet, so they'll come out and do a checkup in a year just to see how you're doing. A provisional accreditation means that you are, not quite meeting the standards, but they want to give you some time. They want to work with you, and so you'll probably have some items that you'll need to submit, and they'll work with you throughout that year to get you to that full accreditation. Non-accreditation, which no one wants, is a loss of accreditation, and that's typically due to a safety incident or something that is far out of compliance with the standards set forth by CARF. And then a preliminary accreditation result is usually for up-and-coming starting organizations who have not accepted clients yet. They'll provide that preliminary accreditation based on review of the administrative or Section 1 standards, and then they'll resurvey in about 6 months once you've opened, you've had clients, to review those program standards to make sure that you're in compliance. So I will pause here and ask if there are any questions about CARF accreditation.
And yes, Danielle, we do have 2 questions. The first one would be, should programs only contact CARF once the program is functional or in operation?
So that's under the preliminary accreditation. So let's say you're a brand new program, you're looking to open up and get started. You will contact CARF, notify them that you're looking to get started, submit your application, and they'll come out and do a preliminary survey. And that survey is going to look at the administrative standards of that program, look at the plans and the policies that you've developed and that you're looking to put in place. And if they're satisfied with that, then they'll grant you preliminary accreditation so that you can open up your facility, you can start accepting clients, and then they'll return in about 6 months or so and look at the program standards to make sure you're in compliance with those standards.
And do you have time for one more question, Danielle?
Absolutely.
Okay, it was, where do you find the self-evaluation for CARF?
That is going to be in your Customer Connect portal. So once you've reached out to that resource specialist, they'll help you get set up in setting up your profile for for CARF and setting up that portal. And then even before you complete an application, you can get access to that portal and get access to the resources in there to help your organization get started on the path to accreditation with CARF.
We have two more questions. Do you have time for that, Danielle?
Sure.
It says, can you accredit under LLC as a single practice?
That is a good question. That I will have to look into. I'm not sure if you can. My instinct is yes, but I'd have to get some more information and provide that for you.
Okay, and the next question is, what is the approximate amount or cost for the whole process? About 3 years.
That would depend on the size of the program, the number of surveyors that come out, the census of the program, and the number of programs that you are looking to accredit. So that's going to be specific to your organization, and that's information that you'll be able to get from that resource specialist.
Okay, and another question was, where can I find a format for a strategic plan?
A format for a strategic plan. So there are resources through the Institute of Healthcare Improvement that you can reach out, that you can get, and also through the Studer Institute, through the Quint Studer, I believe they're called the Studer Institute, that can help with strategic planning and providing you templates and formats for that.
Okay, and we have another question. Do you have time?
Yeah.
Okay, the next question was, would you mind giving some figures based on your experience in this area? I think it's referencing the, I think it's a follow-up question from the approximate cost of the whole year, of the whole process.
So based on my experience, for CARF, the total has come out to around $4,000 for organizations that I have been a part of, and that covered the accreditation, the annual accreditation fee, as well as the survey fee for the first year. Again, it will vary depending on the size of your organizations, the programs that are being covered, and things like that.
Thank you, Danielle. That was all of the questions at this time.
All right. So we'll go ahead and move on to the Joint Commission. Now, the Joint Commission was formerly known as JCO. A lot of people who've been around the industry for a while know it as JCO. However, and that stands for the Joint Commission on Accreditation of Healthcare Organizations. However, that name was shortened to the Joint Commission in 2007. So the Joint Commission is the nation's oldest and largest standard-setting and accrediting body in healthcare. They accredit and certify more than 22,000 healthcare organizations and programs in the United States. And these include hospitals, surgery centers, ambulatory health centers, behavioral health care and human services organizations, home health providers, medical equipment providers, hospice centers, lab services, and nursing homes and rehab centers. And an important distinction between the Joint Commission and CARF. With CARF accredits your program. So you can have a CARF accredited IOP program or a CARF accredited therapeutic community. With the Joint Commission, they accredit the entire organization. So you are a Joint Commission accredited organization. So brief history on the Joint Commission. In 1951, the American College of Physicians, the American Hospital Association, the American Medical Association, and the Canadian Medical Association joined with the American College of Surgeons to create the Joint Commission on Accreditation of Hospitals. So the primary focus of this organization was to provide voluntary accreditation and to set the standards for medical and surgical practices in hospitals. In 1970, they established the Accreditation Council for Psychiatric Facilities and began providing accreditation for inpatient psychiatric programs, substance abuse programs, and mental health community mental health programs. And then in keeping with changes in healthcare, particularly in the behavioral health field, their standards have undergone several updates, including in 2016, when they updated their standards to address eating disorder treatment programs within the behavioral health model, and then the standards also underwent another revision in 2019. And this is the expectation that you can expect from Joint Commission as they review best practices and industry standards. They'll continue to update their standards on a regular basis to keep behavioral health and to keep their organizations on the cutting edge of what's providing best outcomes and best care for their patients. So is the Joint Commission accreditation right for your organization? So the Joint Commission behavioral health standards are adapted from standards used in hospitals. Like I said, this organization was started mainly for establishing practices in the hospital setting. So a lot of their language and their standards are derived from that space. So there's a lot of focus on patient safety concerns such as medication management and the use of medication and medication errors, as well as infection control. The standards also focus more on the practices and the processes of the organization and adherence to the organization's policies to create a safe environment and provide safe care for the individuals being served. The Joint Commission's gold seals of approval is widely recognized, and most people know what it looks like and know what it is, and they can identify it when they see it, and it's become recognized as a symbol of excellence within not just behavioral health, but the healthcare more generally. And then if you choose to join the Joint Commission as your accrediting body, you will be joining the country's largest network of accredited healthcare providers. So there's a huge network with resources that would be available to you by joining that accreditor. There are a few things that make the Joint Commission different, that make them stand out. And one is their use of tracer methodology. Now, tracers allow surveyors to identify performance issues in one or more steps of the process or interfaces between processes. And there are three types of tracers that the Joint Commission uses for their on-site and or virtual surveys. That's the individual tracer, the system tracer, and the program-specific tracer. So for the individual tracers, these are designed to trace the care experience that a patient had while receiving services from the organization. It's a way to analyze the organization's system of providing care using the actual patients as the framework for assessing these standards. So they'll take a patient and follow the course of their care from admission to discharge. They'll look at their assessment process, where they're placed, the services that they've provided, the ongoing care that's provided. And then from there, they'll be able to pull out adherence to policies or staff trainings and things like that based on the care that this client has received. Patients selected for these tracers will likely be in those high-risk areas or whose diagnosis, whose age, whose type of services received may enable the best in-depth evaluation of the organization's processes and practices. So for example, they may review a client in detox to review your practices on assessment and placement. Or they may ask you to review a client with a history of trauma to see how you screen for trauma and how you incorporate that information into the planning of care for that person. So that's a little bit of how the individual tracers work. There are also systems tracers. So while the individual tracers follow a patient through his or her course of care, the system tracer evaluates the entire system or the process, including the integration of related processes or the coordination and communication between departments involved in those processes. And this usually is a really interactive session between the surveyor and staff members. This is where they have these staff interviews and they get to talk about what staff do. And so the three topics evaluated by systems tracers are data management, infection control, and medication management. And so they'll sit down with a nurse or with a staff member and, say, hey, walk me through, your hand washing procedures or your hand hygiene protocol. Or, for example, I can give you an example from one of my recent Joint Commission surveys. They met with a TA, and they said, I'm just going to stand here observe while you do medication observation. And so they observed, from the hand hygiene to the two patient identifiers to identifying the correct medication to the correct documentation, and they just observed that whole process of the system. That's what a system tracer will look like. And then accreditation program specific tracers. The goal of these tracers is to identify risk points or safety concerns within different levels of care or treatment and services. So they focus on important issues relevant to your organization or the high risk, high volume patient populations that you may encounter. So for example, if you have an eating disorder component to your program, they may ask for a tracer of that program or a first responders program. They may want to look at the systems involved in care for those clients as well. So another distinguishing feature about the Joint Commission is the National Patient Safety Goals. So based on data collected from surveys all across the country over the years, the Joint Commission identified specific areas of concern related to patient safety. Then they developed these goals that are specific to the types of programs that they accredit to address these concerns. And these are their National Patient Safety Goals. So within the behavioral health program for Joint Commission, there are 4 goals. And there have been 4 goals for as long as I've been working with Joint Commission. The first one is identifying individuals served correctly. And this involved using at least 2 patient identifiers when administering medications or providing treatment. The next one is using medication safely, which focuses on ensuring that information about medications are recorded and communicated effectively, not just between the healthcare providers, but also with the patient. The next is preventing infection. And this focuses on hand hygiene as the primary way to reduce the spread of infection within behavioral health programs. And then last is identifying individuals served safety risks. This focuses on reducing the risk of suicide through assessment, treatment, and environmental safety. Now, the third distinguishing feature of the Joint Commission is their use of their SAFER matrix. Now, SAFER stands for Survey Analysis for Evaluating Risk. In accordance with the Joint Commission, it is a transformative approach for identifying and communicating risk levels associated with deficiencies cited during surveys. And this helps organizations prioritize and focus their corrective action items on their high-risk areas. So when the surveyor is with your organization and they're going through, they're conducting their survey, any all observations of non-compliance are documented within this matrix. And every observation of non-compliance will require corrective action to be implemented. And those are submitted within the evidence of standards compliance template, which is the Joint Commission speak for a corrective action plan. Now, the amount of information required within this corrective action plan reflects the risk level as assigned by this matrix. And I'll tell you what I mean. So items are scored according to the scope of the deficiency, whether it be limited, a pattern, or a widespread deficiency, and the likelihood of harm to a patient, a staff member, or a visitor. So low risk, moderate risk, or high risk. So for example, out of 3 charts reviewed, 1 chart had an incomplete discharge summary. They may assign that as a low risk, limited scope finding on the matrix. So it'll go in that bottom left yellow corner. If 2 or more charts that they looked at had incomplete discharge summaries, they may assign it as low risk, but a pattern in terms of the scope. So we'll move into that yellow box at the bottom. If a deeper review reveals that the organization just doesn't do discharge summaries at all on any of their clients, then that may be moved up to a moderate widespread risk or moderate widespread finding. So typically, and these are just general guidelines, findings related to documentation, with the exception of risk and safety assessments, those tend to be low risk. Findings related to medications or infection control, those tend to be moderate risk. And findings related to suicide risk or medical safety or environmental risk tend to be high risk findings. And so depending on where those findings end up on that matrix, whether low, moderate, or high, limited, pattern, or widespread, that will determine the amount of detail and how thorough your corrective action plan needs to be. So for example, a moderate, widespread risk might need to involve leadership, facility leadership, or change in policy, or additional staff training, or things like that. Whereas a low, moderate, a low limited risk might just be a retraining of that individual staff member or something like that. And then another area of the matrix is immediate threat to life. That's all the way at the top in deep red. Now, if the surveyor finds an immediate risk to life during the survey, they are required to stop the survey and report that information to the leadership at the Joint Commission, and that will put your accreditation in jeopardy. So that could include things like not completing suicide risk assessments or things like that, or major environmental risks that pose a real risk, a real danger to the safety of the clients or safety of the staff. And then a caveat here is, the placement of items on the matrix depends on the surveyor discretion. So they may place things in a moderate or widespread or pattern category, depending on what they see and the patterns that they've been experiencing during the survey. What we'll do is we can stop right there and take a 5-minute break and come back at 11:05 to continue.
Hello, everyone, and welcome back to today's webinar. I am going to go ahead and turn it over to you, Danielle, and we have two questions from the crowd. Is that okay to go ahead and ask you them now?
Absolutely.
All right. The first one is, can you please provide the names of the two resources for sample strategic plans?
So one was the Institute of Healthcare Improvement, so it's IHI, and the other was the Studer Institute.
Thank you. And the next question is, does this mean that you can be accredited by CARF and may not need or require accreditation by TJC?
That's correct. So the Joint Commission accredits the organization, whereas CARF can accredit a program. So you can have a CARF accredited outpatient program, for example. Because I've seen facilities where their main campus, their main residential site is Joint Commission accredited, but they have a CARF accredited outpatient site. I've also seen organizations that maintain both accreditations because their focuses are a bit different, but they're both not necessary. So you don't have to carry both.
Thank you, Danielle.
All right, so we'll move on through and we'll discuss a little bit about the Joint Commission behavioral health standards. So the Joint Commission divides their behavioral health standards into 14 sections. First is care, treatment, and services, which is a chapter that provides the standards that reflect the flow of treatment for that client and what's provided. So that includes their entry to care, the screening and assessment process, the planning of delivery and planning and delivery of their care, as well as continuity of their services. Emergency management involves identifying risks and vulnerabilities when it comes to environmental emergencies, and then developing a comprehensive emergency management plan based on those identified risks. And that plan should cover managing the care, treatment, and services provided during an emergency, communications, resources and assets, safety and security, and staff responsibilities during an emergency. And that can include hurricanes, tornadoes, fires, anything that, any environmental emergency or any emergency that can affect the operations of the program. The environmental care section is about promoting a safe, functional, supportive environment within the organization so that quality and safety are preserved. And the environmental care is made up of 3 elements. It's the building or the space that the organization's in, the equipment used to support the care, treatment, or services provided, or to safely operate that space or that building, and then the people who work within that organization, or anyone else who enters the environment, all of whom have a role in minimizing the risks to that environment. Human resources management, that section addresses the organization's responsibility to establish and verify staff credentials and staff qualifications, to correctly, appropriately orient their staff, and then to provide staff with the training that they need to support the safe care treatment of the patients that the organization serves. And then after staff members are on the job, human resources must provide an assessment of their competencies and their performance to ensure that it's safe and it's meeting the needs of the clients. Infection control and prevention addresses the activities of planning, implementing, and evaluating the infection control and prevention practices of the organization. Information management involves the management of the clinical record and the privacy, the security, the integrity of the data and the information that the organization collects, which results in the preservation of confidentiality for that individual. The leadership section is focused on creating a culture that fosters safety. If you'll notice, that is the theme of the Joint Commission, is a culture of safety. Like we mentioned before, it's the Joint Commission accreditation stems from accrediting or standardizing practices within hospitals and surgery spaces. So that is the model and that is the mantra for that organization, is a culture of safety. And so that leadership section focuses on fostering that culture as a priority for everyone who works in the organization. In addition to planning and providing resources for services to be provided to meet the needs of the person served, making resources available, whether human resources, financial resources, physical resources for the provision of care, treatment, and services, and so on. The life safety section. This chapter addresses several topics within the life safety code, including general life safety design in building construction, fire alarm notifications, the suppression of fires, including sprinkler systems, and then building services, including elevators and chutes and so on. Medication management. This section provides the framework for an effective, safe medication management system. It covers managing high alert medications and hazardous medications, selecting, procuring, and storing meds, managing emergency supplies and emergency medications, controlling what's brought into the organization by the patient or their families or other providers, managing medication orders, preparing, labeling, and dispensing meds, administering them and doing that safely, and then monitoring patients' reactions, and then responding to tracking and trending adverse drug events or adverse drug reactions or medication errors. The National Patient Safety Goals, we already discussed. Performance improvement, that addressed data collection, so collecting data, analyzing data, and taking action to improve and monitor performance. Record of care, treatment, and services, that chapter contains the documentation requirements for the care, treatment, and services provided. And that standard also provides the policies and procedures that guide the completion, the compilation, retention, and release of records. Rights of individual served, rights and responsibilities. The standards in this section address informing individuals of their rights while in treatment, helping individuals understand and exercise their rights, respecting values, beliefs, and preferences of the individual, and then informing the individual of their responsibility regarding their care, treatment, and services. And then lastly, we have wave testing, which covers the requirements for CLIA waived labs in programs that have CLIA waived labs. So steps to Joint Commission accreditation. So first, you will contact an account executive, similar to CARF, and that person will help you navigate the initial steps of applying for accreditation. They'll help you set up your profile with Joint Commission's Connect portal, and there you'll find your resources and your ability to complete your application and things like that. That's also where you'll get access to the e-standards, or the electronic version of the standards for your program, which would be behavioral health, and those are free. From there, you will then complete the self-evaluation for the organization, and you'll compare your organization's policies and practices to the standards set forth by the Joint Commission. and then you'll address any gaps or deficiencies that arise from that evaluation. And then once you've done that and you are ready for accreditation, you will complete your application through the portal and identify the month that you will be ready for an on-site or virtual survey. Your survey will be scheduled and your surveys will be assigned in advance of the survey, usually 7 days in advance of the survey. Now, a note here, the initial joint commission is known for having unannounced survey visits. That applies to hospitals and critical access centers and things like that. Within behavioral health, if you are a freestanding behavioral health facility, meaning that you're not attached to a hospital or critical access center or things like that, if you are a freestanding behavioral health facility, you get a 7-day notice. So it's not quite unannounced, but you are still expected to be prepared for when that survey time comes. You get a 7-day sort of lead time. So when you schedule your survey, they'll schedule your dates, they'll assign your surveyors, and then the big day arrives and you participate in your survey either virtually or they'll come on site. Then what happens next? So the organization receives its final accreditation decision when it has demonstrated compliance with the standards. Once the organization's corrective actions have been reviewed and accepted, an accreditation decision will be granted effective of the last day of the survey and is valid for approximately 3 years, 36 months. The Joint Commission typically renders accreditation decisions within anywhere from 2 weeks to 2 months after the survey. Now, are there any questions regarding the Joint Commission?
Hey, Danielle, we actually do not have any right now.
Now we'll move on to COA, which is the Council on Accreditation. COA is a smaller and slightly newer accrediting body, but it's growing steadily. COA accredits the full continuum of child welfare, behavioral health, and community-based human and social services for children, youth, adults, and families. Now, COA is more focused on programs that focus on social services as opposed to healthcare, as with the Joint Commission. These include child and youth family services, behavioral health, aging services, homeless services, services for persons with developmental disabilities, residential services, financial and education and counseling, employment assistance programs, adoption home study programs, and other social services. More than 1,600 accredited or in-process organizations are currently affiliated with COA, and organizations receive 4-year accreditations with COA instead of 3 with Joint Commission and CAR, with the exception of opioid treatment programs, which are 3 years in compliance with SAMHSA regulations. Brief history, the Council on Accreditation was founded in 1977 by the Child Welfare League of America and the Family Service America, known now the Alliance for Strong Families and Communities. And then by 1980, they expanded to include mental health services, and then by 2002, they were approved by SAMHSA to accredit opioid treatment programs. Now, COA's accreditation programs are broken out as follows. So they have standards for private organizations, which is what encompasses the majority of the programs COA accredits. They're private organizations. They also have standards for public agencies, Canadian organizations, military family readiness standards, as well as child and youth development standards. Now, is COA right for you? So COA accreditation is specifically for human and social services program. similar to CARF. That's the exclusive focus. COA also utilizes an unpaid volunteer peer review system to review their site, to conduct their site surveys. So they have a diverse group of over 400 professionals who work for free, representing hundreds of years of experience in the field. And to become a COA peer reviewer, you must be a current or past employee of a COA accredited organization with at least 5 years of management and supervisory experience. And then site visit findings are reviewed by an accreditation commission within COA prior to a determination being made. So accreditation decisions are not based solely on the impression of the surveyor, but it's taken back to a committee and reviewed. The COA standards are divided into 3 sections. Section 1 covers the administrative and management standards. Section 2 covers the service delivery standards, and Section 3 covers the service standards for each program. The administrative and management standards address practices that promote sound operations and management of the program. So these include your financial management, governance, HR, network administration, performance and quality improvement, and risk management functions. The service delivery administration standards address practices related to the administration of services, including client rights, training and supervision, and program administration. These also apply to all organizations. So these include administrative and service environment, behavior support and management, client rights, program administration, and safety and training supervision. Now, Section 3 are the service-specific standards, and they address the practices related to service provision areas across the full continuum of community-based, social, and behavioral healthcare services. So they apply based on your organization's scope, the population served, and they include child, youth, and family services, behavioral health services, aging and homelessness services, intellectual and developmental disability services, residential services, and additional social services. So how do you become COA accredited? Now first, similar to the other in a departure from the other accreditations, first you submit your application. You submit your application for accreditation, and COA reviews your application to confirm that you are an actual eligible organization to pursue accreditation with them. Then they send you you send your organization's primary contact information, you sign an agreement with them, and you return your accreditation fee, and that begins the process. COA then works with you to help you understand the process, what's involved, the standards that are applicable to your organization, assess your current accreditation readiness, and any specific needs that you might have. You are assigned an accreditation coordinator that help you navigate this process. Next, you complete a self-study, similar to the other accreditation, other accrediting processes. This self-evaluation provides your organization with an opportunity to look at your current policies, look at your procedures and practices that you have in place, and see how they align with the standards. And then you collect your documentation and your narratives that show that you have implemented the standards based on that self-study, and you submit them to COA along with that self-study. And that is actually a part of the official accreditation process, is that self-evaluation and that documentation. Then after that, next is the site survey. So a team of volunteer peer reviewers come on site, or they may do it virtually, and they run a site review. When the site review is complete, they send your organization a report that summarizes that visit and provides the findings, and this is called a pre-commission review report. And then in that report, it includes recommendations about how your organization can improve and how you can demonstrate more effective standards implementation. And they also offer you an opportunity to show what you've implemented. That report is reviewed by the Accreditation Commission within COA, which is a group made up of the most experienced peer review volunteers. And they look at all the evidence provided, as well as any updated evidence that you submit, and either approve your accreditation or request more information. Once a decision is reached, they send your organization a final accreditation report. And that report includes a complete set of ratings for all of the assigned standards. Now, the COA process takes about 12 to 14 months from start to finish. Do we have any questions about COA?
Hey, Danielle, we actually do have a question. However, I'm not sure if it comes right with COA, but it is the same question that we had before. Can you become accredited under an LLC under this?
So you can become accredited as an LLC. As a single practice, I'm not 100% sure. I'm not sure about the size and scope of the practice and the requirements around that. That I would have to research and get back.
Thank you, Danielle. That's all. Oh, we have one more question coming in. It is, do we have to do both COA and CARF or one or the other, depending on the program offers?
That would depend on the circumstances around your organization. Is there a need for both? Are there payers requiring a specific accreditation, be it CARF or COA? Typically, you don't have to have both unless there's a requirement by a payer or another body that's requiring you to have a specific accreditation.
Thank you, Danielle.
All right. So now we get to the fun part. How do you become survey ready? Here are a couple of strategies for success. Don't rush the process. You need to give yourself and your organization ample time to prepare. Plan for at least 12 to 14, even longer depending on your resources, months of preparation prior to the anticipated survey date. Depending on the size of your organization and the size of the team that you have working on your accreditation process, you might need more time. But really give yourself that lead time to really prepare, to get familiar with the standards, to implement your processes, to evaluate them, make sure that they work before you have a surveyor come out. Then you want to assign an accreditation champion. This person will be the point person for coordinating the process in preparation for the survey, and then also coordinating the on-site or virtual survey. This person will need to be organized. They will need to be detail-oriented with strong leadership skills, and they need to have the support of the organization's leadership. Now, depending on the size and the structure of your organization, it doesn't necessarily have to be a senior leadership person in this role, but they do need to have the full support of the organization's leadership in order to implement the changes that need to be made based on the standards. Then you want to assemble your accreditation committee. Create your team. As we reviewed, the standards for these accreditors are all pretty comprehensive. They touch just about every aspect of an organization in behavioral health. So you'll need your subject matter experts in clinical, in operations, in medical or nursing if applicable, as well as the involvement of your leadership team in order to push forward with accreditation. Get familiar with your standards. So I cannot stress this enough. If you have not heard anything else I've said, please hear this. Get familiar with your standards. Accreditation is an open book test. There are no secrets. They give you access to all of the standards in advance. And usually surveys that don't go well, the reason why they don't go well is because the participants are unfamiliar with the standards, so they don't prepare well. Next, you want to conduct a gap analysis or self-evaluation or self-study. They all call them different things, but you want to do that self-evaluation. Review your processes, review your policies, and then match them up with the standards and identify where your gaps and deficiencies are, and work on that. There are different ways that organizations do this. Some create an evidence of compliance binder, where they compile all the policies and sample documentation related to each standard, and so they know exactly what matches up and what doesn't. Personally, I've done that electronically. So I've created a crosswalk where I input the standards into a spreadsheet, and then enter, next to each standard, enter the corresponding policy, organization policy, policy number, the supporting documentation, and where that documentation is kept. And then I highlight those standards that don't have a corresponding policy or corresponding documentation, and I focus on those. And that way I know exactly where my gaps are and what I need to focus on. Then next, you want to prioritize significant gaps or areas that require large-scale changes. Because these changes will require more time and more resources. So if you have to retrain your entire clinical team on completing treatment plans or psychosocial assessments, or if you have to make major changes to your physical plan, you want to make sure you prioritize those things so they get completed and you can demonstrate compliance prior to the survey. The expectation for any survey is that you demonstrate compliance at the time of the survey. You want to have your changes implemented, not in progress when you're being surveyed. Next, you need to prepare. Prepare. Not just your practices, but also your documentation. Review and revise your policies and your procedures. And then make sure your staff are notified of policy changes and retrained on the policies as needed. Make sure your documentation to support your compliance. Make sure you have documentation to support your compliance with each standard. Be prepared to prove your compliance. You also want to begin preparing staff as early as possible in the survey process. Get them familiar with the accrediting organization. Explain what the process is about and why it's important to the organization and why it's important to them as an employee. And also it's also important to be clear in your communication with staff when changes need to be made in order to cultivate that buy-in and that acceptance. So be sure to communicate that, CAR for Joint Commission or CORE, that, they're not forcing the organization to do anything. They're not doing it because CARF made them or because Joint Commission made them. They're making these changes in order to comply with these standards because they want to develop a higher level of quality. They want to elevate the services that they provide. They want to elevate the care and the treatment that their patients and their clients are receiving. So it's not, a forced thing. It's everybody working together to improve the patient experience and improve the care that's being provided. So you can start prepping your staff by posting flyers. You can publish FAQs to provide more information about accreditation. You can hold town halls, etc. So when it comes to survey day, a couple of general tips that I found helpful. Be prepared on the days of the survey. So make sure you arrive early. Make sure you have backup copies of all your documentation, whether paper copies or cloud-based copies, so that you're not scrambling or running around, that you know where everything is and you can find things easily and they're easily accessible. A big one, do not lie to your surveyor. If there's something missing or something incomplete or you just don't have something, say that. Be honest. Do not lie to your surveyor. They have done way more surveys than you have. And they can figure out very quickly if you're not being truthful. And that can create an environment of mistrust, and it can make surveys very difficult. So always be honest, always be upfront, even if it results in a finding. And remember that surveys are supposed to be consultative, not punitive. The purpose is not to rap your knuckles or to wag their finger at you and point out everything that you're doing wrong as an organization. The purpose is to improve the quality of care, the safety of clients, and the safety of staff. So use it as a consultative experience. Ask questions. Your surveyor is probably very experienced and very knowledgeable, having seen how it's done at several other facilities. So use that opportunity. If there's something that you haven't done well, use that opportunity to get some best practices or gain more knowledge, or to find out what's new and innovative that other providers are doing. Get their feedback on any areas or any approaches that your organization may have. So if there's something new that you're thinking about, or you're trying to implement, or you're planning on, get their feedback, get their consultation. You have experts sitting right there with you. Definitely use them to your advantage. During the survey, be sure to bring in your subject matter experts for tracers or for interviews. It doesn't always have to be your senior leadership that's sitting there with the surveyor. If you have a staff member who is really familiar with a particular process or with documentation, or maybe they've created something or implemented something, bring that person in, have them talk about it. Because they would probably know better and be able to provide a better, fuller picture of what your organization does, since they do it on a daily basis. And then share your strengths. If there's something that your facility does exceptionally well, even if it's not directly related to the survey areas, don't be afraid to talk about it. Seek out opportunities to demonstrate your excellence in the work that your organization does. So now that you've gotten the accreditation, you've gone through that process, that was only the beginning. Your organization now needs to demonstrate continued compliance with the standards of your accrediting organization. And this is done through conventional, run-of-the-mill performance improvement methodologies. First, you need to develop your plans and your policies based on compliance with the standards. Then train your staff according to your policies, and implement the practices according to your policies, and monitor compliance with your policies, and evaluate any changes or updates that need to be made. Then start all over. This is the process. This process begins whenever there are changes in the standard, changes in your organization's plan, or changes in your organization's policy. Now, there are also resources for continued compliance that come with your accreditation. Each accrediting organization has an annual monitoring tool to assess your compliance. So CARS has their annual conformance to quality report. Joint Commission has an interactive intra-cycle monitoring tool. COA has a maintenance of accreditation report. These tools allow organizations to survey itself for compliance to the standards in between their on-site surveys, if they're every 3 years or every 4 years. This enables you to identify gaps or deficiencies more immediately instead of waiting for a surveyor to point them out 3 years later. You also want to utilize the resources available. Your accreditation fees usually grant you access to a host of resources that come through your accrediting agency. Things like best practices reports, things like heads-up reports to inform you of issues or trends that are being seen at other places around the country, resources around COVID. There are plenty of those available on accreditation portals and web pages now. Discussion boards, so you can speak with quality leaders from other organizations. Lending libraries, so you can see what their documentation looks like and borrow templates and things like that. use all of these resources to your organization's advantage. I mean, you've already paid for them. And then you want to evaluate your plans annually. So use the analysis and the results of last year's plan to inform the goals and objectives of next year's plan. That's how continuous quality improvement works. Figuring out what worked before, what didn't, and using that information to build on for the next year. And then finally, you want to stay current with the most updated standards manual. You are responsible for knowing your standards and being familiar with your standards and keeping track and monitoring any updates that come out. There might be supplements that come out in between manuals being published. Like, for example, they might publish supplements for telehealth or supplements around infection control for COVID, things like that. So you want to be aware and stay current of those things. You also want to conduct routine surveillance of your processes. Don't take it for granted that you have a working process in place. Staff changes, census changes, changes in resources can affect your processes. So example, a gap in a leadership position, or a change in the acuity of your clients, or a supply chain issue can cause deviations from the established processes. So it's important that you stay vigilant and perform that routine surveillance so you can identify when those things happen. Another tip that I found helpful is to keep a compliance calendar. So plan out things like committee meetings and inspections and action items that need to be completed monthly, quarterly, annually, so that you can track them. It doesn't have to be a rigid calendar where, you know, dates are fixed and no one can move, so everybody has to cancel their vacation for a committee meeting, but you want to make sure that you're keeping an eye on those things so that it's not New Year's Eve and you realize you didn't do a hurricane drill that year. And then lastly, training. All of the best plans, all of the best policies, all of the best processes in the world do no one any good if your staff don't follow them. So to borrow a phrase from Quint Studer, you want to hardwire your processes so that the accreditation standards and the standards for your organization are one and the same. And with that, do we have any questions?
Hey, Danielle, yes, we do. We have one. The question is there a crosswalk we can obtain for COA?
That I am not sure of. So the crosswalks that I have, I've created myself. I'm not sure if that's the crosswalk specifically is a resource that's available within their portal, but that's definitely a question to reach out to an account executive or a accreditation coordinator and ask.
The next question was, is your crosswalk something you would be willing to send to everyone?
Certainly, I can extract my data and I can send you the template of it. I'll provide that to Rebecca and she can send that out.
And Danielle, if you are done, it looks like we are going to wrap early. We don't have any further questions. Danielle, do you have anything else you would like to add before we go ahead and wrap up?
Thank you guys so much for your attention and allowing me to present this information. I hope it was helpful and useful. And if you have any questions, my contact information is at the beginning of the presentation. Feel free to reach out.
Okay, well, we have included Danielle's contact information so that you may contact her with any further questions. And Danielle, we really want to thank you for all the work you put into this webinar and all the invaluable information that you shared with us today. We're sure this training will help practitioners better serve those. When I conclude today's webinar, your browser will take you to an evaluation on FATA's website. If you would like to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you register for webinars through our WebEx link than when you set up your profile in FATA system. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be messenger@webex, and the evaluation will close at midnight on Monday, May 3rd. We do not email statements of credit. Instead, after we verify attendance and complete the evaluation, a statement of credit will be generated as a journal entry within your profile. Thank you again for participating in today's webinar. We'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Please have a great rest of your day and hold for the evaluation.